So two key reasons, or three. The first one was the birth of my daughter, Zuri. And, in 2012, my wife is a doctor, and, we had to be at a hospital for Zuri's birth. Okay. And the doctor says, 9 a.m., we need to do the CS. There's a cord on the baby's neck. I was okay, great. Let's go to the hospital. And 9 a.m. turned to 9 p.m. Then doctor is not picking his calls. Phone is dead. And, she's going into a crisis. And I'm struggling to get information. And they're asking, what are her health records? What has the doctor said? And I was a bit worried at that point. Eventually, when the doctor came, my question was, the experience wasn't great. And we're in a very good hospital in Nairobi, one of the best. And I couldn't find doctors, right? Oh, this doctor is coming, he's busy, oh, this one. So is there a place I was thinking of? I said, I couldn't find doctors. So I said I was going to build a mother and child hospital when I become rich in future. Then I was going to build a mother and child hospital and make it easier for people to get treatment, because I saw how difficult it was, even if I could afford it, even when I could afford it, to get healthcare. And what the important thing was, when my baby came out, my baby was distressed. So that time loop that was spent waiting at the hospital affected, but luckily everything turned out right. But for me, that experience, that very painful experience, was in my head. So when I started looking at, in 2017, 18, what was happening around the tech space, I figured that healthcare was going to be the next to be disrupted. So I said, maybe I need to get in on this and make some money, and maybe partly fulfill my earlier promise that I was going to build a mother and child hospital. So, I wasn't sure. I said I was going to build the doctor booking app, where you're just going to look for doctors and book a doctor, find a doctor within your locality. Then something interesting happened to me in 2020. So 2020, I just come back from the UK and I was very unwell. And that was when COVID broke. Mm-hmm. So, I didn't want to go to the hospital when I was sick, So my wife said, you know what, I'm going to ask you to do some tests, but I'm going to ask them to come at home and take your samples. So when they came, they took my urine, my stool, and my blood. And I remember turning to her to ask, is this legal? Or are you, because you're a doctor, so you're like a G, you're trying to pull G moves so that they can come out? Can this be done for everybody? He said, yeah. I said, it's possible. He said, yeah. I said, okay. So when the results came out, I needed to do other tests. And I did other tests, and evidently they said I was diabetic. So I had type 2 diabetes, and I had to get on, see a specialist. So this was when COVID happened, and the people who had died were diabetic. I'm like, it has become now. So you have my permission, find another good man and marry, take care of my children. But I don't know. I don't know how I'm going to do this thing with you, bro. All right, and going to the hospital was a no. So all the doctors we were calling kept saying that they are not seeing patients. They could talk on the phone. I found a good one. We spoke on the phone, and he asked for other tests, which went through the same route, calling them to come pick my samples, getting the result and sending it to him on WhatsApp. And he gave me a prescription. Now, with this prescription, I used the prescription and called the pharmacy, who I bought the medication, and they delivered it to me at home. And it occurred to me that I started my healthcare journey and ended my healthcare journey without leaving my house. So you see me beginning, and so I said, no, I'm going to pivot. I'm going to not just build a doctor booking app. I want this experience of a doctor consultation, lab tests, and having my medications delivered to me on one place. So I consolidated that in what we're building for Zuri Health. But it was also important, me from my vast background, knowing and understanding that because over 65% of mobile phone users don't have access to data or smartphones, it was important that they had some form, and they can't afford it, some form of medical care, which is an opportunity to get first level medical consultation and from doctors for 10 US cents daily. And that was why we incorporated that with Zuri Health. So yes, that is how we, went on the journey of Zuri Health, and that's why it's called Zuri Health.